On January 30th, Uganda confirmed an outbreak of the Sudan Ebola virus disease. Since then, more than 10 cumulative cases have been recorded, with 2 active cases currently receiving treatment. The most recent death was a 4.5-year-old child who passed away on February 25th at Mulago Hospital. Following investigations, 4 people have been isolated and samples have been sent to Kampala for testing.
One of the cases, who was 4.5 years old, died, and upon doing the tests, I was actually found to have Ebola. And then when they traced back, they found out that about 2 weeks back, the mother of that child had died and was buried in Toroko.
Contact tracing has identified several individuals who had been in contact with probable cases, and more tracing is still ongoing.
Contacts to the probable cases are very many. By this morning, together with the team from Ministry of Health and the World Health Organization that we work with and our regional EOC, the contacts so far about 100, and I know by close of today, we should be more than 200.
4 suspects of Ebola and more 2 in the field. They have told us they are yet to pick. And mind you, we have 5 beds in Uhinga referral for Ebola for emergency. So if the number is running at this speed, it means we must disseminate the information faster to the community to tell them for these don'ts to be there.
Meanwhile, training of health workers in Fort Portal City has begun, focusing on how to handle suspected cases and those confirmed without stigma. Health authorities have urged the public to remain vigilant and report anyone displaying Ebola symptoms.
We have 2 patients that are contacts of the child that we lost, who was discovered at post-mortem. We are still carrying out very intense surveillance, following up, but not only on this current cluster, but also the other previous cluster and the entire Kampala metropolitan area, including Luero, Mpigi, and the current areas of Fort Portal and in Toroko.
Ministry of Health says whereas there was confusion among some members of the public after 8 cases were discharged last month, with many assuming that the outbreak was over, this was not the case.
We had only begun 3 days. We were only 3 days into the countdown, and this case appeared. So it is not a surprise. It is still within the outbreak period. And my humble appeal to Ugandans is to remain vigilant.